Thank you very much to the moderator, Jean-Michel Pianel, and all the speakers. We now have the pleasure and the honor to invite to the stage our guest of honor from the Ministry of Health of Malaysia, Young Pehomat Dato Lukanisman being Awang Sauni. Excellency, you can please take the floor. Thank you.
Thank you to Mr. of Ceremony. Assalamualaikum, salam sejahtera, salam Malaysia Madani. His Excellency Ari Norton di Nurul Pengelak, Ambassador of Brazil to Malaysia, Dr. Marco Krieger, Vice President of Production and Innovation in Health, Oswaldo Cruz Foundation, PIOCRUZ, distinguished guests, ladies and gentlemen. Very good morning. It gives me a great pleasure to welcome and to address all of you to the Brazil-Malaysia Equitable Access to Medicine Seminar today. A very warm welcome to speakers and all participants from local and abroad. It is a truly honor to have you all here. Access and equity medicines between Brazil and Malaysia is a subject of the utmost importance, and I believe this event will provide us with the opportunity to foster cross-sectorial dialogue and the interchange of ideas and understanding of the subject. Seminars such as this are essential in fostering professional interaction and serve as a platform for identifying synergies and exchange of best practice in tackling this pressing subject. From ensuring the equitability distribution of pharmaceutical manufacturing capacity to combating the discriminations and marginalizations of vulnerable populations, we are poised to delve into the heart of matter. Moreover, we must confront implications of intellectual property's right on public health, a topic paramount importance in our discussion. Distinguished guests, ladies and gentlemen, I believe this seminar on Brazil-Malaysia equitable access to medicines will greatly contribute to our national agenda for healthcare. Our nations, Brazil and Malaysia, despite the geographical distance, we share striking similarities in our healthcare landscape. Both are tropical, mega-diverse countries. Both face common challenge ranging from tropical disease to emerging pandemic and non-communicable disease. And one of the most pressing obstacles we encounter is the lack of affordability of medicines, a constraint that jeopardizes the fundamental right of health for citizens in our respective countries. This reality underscores the urgency in which we must address the issue and sketch the next collaborative actions. Distinguished guests, ladies and gentlemen, as the biggest public healthcare provider in Malaysia, the Ministry of Health faces unceasing challenge in providing access to affordable medicines for the general populations. With the rise of medicine price worldwide, the global economic uncertainty efforts have been meant to mitigate the impact of this situation. For example, since 2019, the Ministry of Health has ventured into full procurement of medicine involving other public healthcare providers, namely the Ministry of Defense and Ministry of Higher Education. This initiative, which encompasses of more than 80 medicines, has provided total saving of 179 million to the government. Ladies and gentlemen, Malaysia has also implemented the generic medicines policy since the establishment of Malaysian National Medicines Policy (MNMP) in 2006. Through this policy, procurement and prescribing of medicines are conducted using international non-proprietary names INN, thus prioritizing the use of generic medicines, which are often more affordable options compared to patent medicines. Malaysia is leading the Asian Drug Security and Self-Reliance Initiative, aiming to improve access to medicines and enhance drug security. Potential collaboration areas include pool procurements, aiming to enhance healthcare affordability. In parallel, this event has provided a unique opportunity to gather expert and relevant stakeholders from the government, civil society, and the multilateral system. Together, we can spur the developments of bilateral and multilateral collaboration toward health for all by harnessing the collective expertise and resource of all stakeholders. We can pave the way for more equitable and accessible healthcare landscape in our countries and beyond. By leveraging regional collaboration and sharing resources, we can confront the health threats of our time more effectively through the South-South cooperations, concrete and ambitious projects such as the Hepatitis C, Rabies developments led by Malaysia and effort from the Dengue Alliance hold promise in this regard. Distinguished guests, ladies and gentlemen, Malaysia takes pride in successful registration of Rabies in 2021 and subsequently inclusions in the World Health Organization's WHO model list of essential medicines in 2023. This milestone underscores our commitment to developing cost-effective treatments for hepatitis C, thereby expanding access to affordable medicines across sectors. Distinguished guests, ladies and gentlemen, before concluding, I'd like to shed light of Malaysia endeavor and aspiration in public healthcare, especially under the Malaysia Madani government. Malaysia has outlined its vision through the National Agenda for Healthy Malaysia, ANMS, a comprehensive 10-year plan engaging governmental, private, and community sector to enhance societal health and well-being. In response to the COVID-19 pandemic, Malaysia has proactively strategized for a resilient healthcare system through the Ministry of Health development of the Health White Paper policy. This policy aims to ensure accessibility, affordability, sustainability, and resilience in healthcare delivery. Moreover, the reform emphasizes the integrations of digital delivery, digital technologies into health systems, including online appointments, virtual clinics, electronic medical record, and leveraging artificial intelligence for disease surveillance and crisis management. Considering the shared challenge faced by both Malaysia and Brazil, nations endowed with tropical biodiversity, it is imperative to address issues such as non-communicable disease, emerging pandemic, and tropical illness. The escalating cost of medication pose a threat to the fundamental health rights of citizens in both countries, requiring collaborative measures to mitigate this challenge. Therefore, the joint determination and commitment that each of you has displayed in this room today to discuss this matter is extremely motivating. It is imperative that we capitalize on this occasion to devise a plan for the future which universal access to medicine is equitable. Together, we can foster the development of healthier and more resilient community while striving to achieve improved health outcome for all individuals. With that, thank you. Terima kasih.